I'd like to welcome Alicia Clark to the patient conversation. Alicia is the Senior Director of Client Services at Svast Healthcare Technologies, where she works with physician practices to increase their revenue on a daily basis. Alicia's time at Blue Cross Blue Shield as a provider relations manager, as well as 20 years in executive roles overseeing billing operations, makes her really a wealth of knowledge in the revenue cycle management space. So I'm excited to talk to her and really thrilled that she's able to join us. I guess where it'd be good to start is kind of giving us a better understanding of what revenue cycle management is and how you think about it for the customers of Svast, kind of as well as like what it means to consider working with a company like Svast for the purposes of kind of revenue cycle management and billing services. What does that look like at a high level?
Sure. So we look at RCM as the term given to the financial process surrounding the management of funds, as well as the collection of payments and the treatment and care that the providers offer to their patients. We put together a pretty healthy client scorecard, which includes a review, like I said, of the health of the practice. We look at aging claims, we look at AR analysis, denial analysis, payment analysis, and adjustment analysis. We find it super important to educate the clients so that we have clean claims going out the door the first time. We like to report upon all of those facets that I just mentioned on a monthly basis, but we offer weekly meetings to our clients as well, offering them the advice that we have for internal processes and efficiencies, offering areas to look at their platform for automation and any other services and types of platforms where we can augment and do, sincerely impact the revenue for the practice.
Got it. So you guys really, and I know this kind of firsthand, but you take kind of a holistic approach because at the end of the day, there's a lot of different variables that play a role in being able to generate revenue for the practice, keeping the lights on, everything from front desk collecting patient demographic information correctly so that you can bill out appropriately, all the way through to the visit itself, how it's coded, and then on the back end, the process by which claims are sent out and followed up on. So I know there's a lot that goes into it, and certainly, I guess the way that as you talk to your customers, that's a lot to consider. If you're a 5-doc practice or a 1-doc practice, it really doesn't matter. It could be a 50-doc practice. There's a lot of things to consider. So where do you focus your energy in kind of showing where the value is that you guys can provide on a kind of customer by customer basis? How do you work through that with them?
Sure. So we want to make sure that physicians can place their focus on their patients. I think that's, priority. So that's where we come in. We take a look at, like I said, the health of the practice, financially speaking. So it means that we're able to offer the educational piece to their staff to be able to submit cleanly the first time. Physicians and providers should, at a minimum, be able to understand their monthly averages for charges, payments, adjustments, collections. They should have that ability to then look at that data in a meaningful way to be able to project the revenue on a month-to-month basis, but to understand how that revenue is driven with the services that they offer. Can they augment in a way that would bring about more revenue for the practice? So we take a look at chart audits, for instance. Are they leaving money on the table there? We take a look at their fee schedule. Have they had a fee analysis in a while? Again, are they leaving money on the table there? We take a deeper look at that through our internal processes and report back to them weekly, monthly, or on an as-needed basis. So we provide a one-on-one representative, which I think is unique to the RCM world. Most you'll call in and get whomever answers the phone. We will assign a client service executive that is specific to your specialty, specific to your platform, and that becomes intimately familiar with you as the client. So I think that is a differentiator for Svast, but we just really want to become an extension of that team and be able to provide that personalized service.
Got it. So, and I think that's actually a good segue. I was going to ask about, I believe you consider yourself an extension of the team. So you create the relationships with the practice where you are, for all intents and purposes, a part of that practice for not just collection of revenue and making sure that claims get processed appropriately, but also I think workflow improvements and optimization over time and making sure that if something is going wrong, it's identified early and addressed, because that can have real revenue impact down the line, right?
That's right. Yeah. So we take a look at what's called first pass pay rate, making sure that that claim is clean going out the door the first time. And while we're working denials and posting payments, we pick up on some of those little nuances where perhaps, they're missing a modifier, a simple modifier, such as the modifier 25. They've done an evaluation and management code and an additional service on the same day, but the insurance carrier is now bundling that and saying, we're going to only pay you for that E&M code because there's no modifier on there that denotes that there was an additional service on the same day. We'll obviously make that correction and resubmit the claim, but the important part of that is to go back to the client to educate them so that modifier goes on the front end, so the claim is clean going out the door and they don't have to wait for the denial or the payment to be posted to then resubmit the claim for reimbursement. So it's a faster turnaround of payment.
Right. And so as far as if I think about like the average practice and bandwidth that a practice manager might have, or a billing manager might have, or limited bandwidth, I guess is probably a better way to think about it. How hard is it for any kind of average practice to stay on top of all of the changing coding requirements, new modifiers, like everything that goes on in your world that Svast are experts on? How difficult is it for your average practice of any size to kind of stay up on all those things?
Well, I think it's almost impossible. I mean, I think in most, especially in today's day and age, things are changing almost weekly with the carriers. We saw that fiercely throughout COVID, right? I mean, they had put out the processes and the specifics for coding throughout COVID, but that was changing weekly. Place of service codes were changing, and codes in themselves, CPT codes were changing, diagnosis requirements were changing. So it's almost impossible to learn on the fly like that and still maintain that level of patient care. And that's really what we want to do. We want to be able to allow the practice to keep that level of customer service at an all-time high at the front, for the physicians and the providers to focus on their patients in the back in the clinic, and allow Svast or whomever's handling their billing to be able to provide that expertise for their day-to-day RCM services. Got it.
So I think you're going to see where I'm going with this next question is, you and I think you've known me for a long time. When I first started working on OhMD, I don't necessarily know that we had considered the implications that OhMD could have on communication for the purposes of revenue cycle and kind of everything that falls into the bucket of revenue generating activity for practices. But I do know that in the early days of OhMD, we did work on some projects together where we were testing the idea of communication over, at the time it was an app, to get patients the information that they needed to pay their bills. How hard is it today? Like, that was many years ago. How hard is it today to communicate with patients for practices, kind of for any purpose? And also, kind of second part of that question is like, what happens if you can't get your patient on the phone? What are the revenue implications of that? Or, if you can't communicate with them about their bill, or you can't get in touch with them about anything really in this process, what does that mean for kind of top line revenue for a group?
Right. Well, sort of in any business, time is money. And the amount of time that we were spending, or a practice would be spending in patient collections, was exorbitant. If you can imagine just trying to get a hold of a single patient, you're taking the time to make the phone call. They see it's a medical billing company, or they see it's a medical practice. We're going to let it go to voicemail. Maybe their voicemail's full. Maybe they will or won't check that voicemail. So the opportunity there is small to reach the patient in that regard. And then again, the cost benefit of having something like a platform such as OhMD to be able to text message and communicate with the patient through texting was phenomenal. It was a real game changer for us, to be honest. We eliminated the staff that we needed to be calling patient by patient. And you're right, for a one doc practice, I mean, you could have 100 patient balances in any given month, but for a 5 or 6 doc practice, that grows exponentially. So you're now looking at trying to reach, a vast number of patients with staff that is nearly impossible. Sending out a text blast to all of your patients in one fell swoop with their accurate patient balance, the ability to click a link simply online and go directly into the into the physician's account was, like I said, a real game changer for us and for the client. So it saves time, it saves money. It's a huge benefit for the patient as well. They also don't have time, and they also don't necessarily take the time to read a paper statement that comes in the mail or even an electronic statement that's sent to them. So for us, anyway and anywhere we can automate, it's a time saver, it's efficient, but most importantly, it impacts the bottom line greatly.
Got it. And this is, I think you pointed this out as well. I was thinking about I guess paper statements and the likelihood that a paper statement is going to be read, opened, or even seen to begin with, seemingly has decreased quite a bit over time. Mm-hmm. And then the idea of like getting out, not that you always have to pay your paper statements by check, but it always does feel like it's a relatively arduous process, whether it's check or you're filling out a little slip of paper with your credit card information. It's just something that I think we used to do all the time because it was kind of the only option. But the consumer behavior has changed so much around what they're willing to do. Like, what hoops is someone willing to jump through to pay you for the services that were provided? So I think one of the things that we've always been excited about is really breaking down those barriers, leveraging text to even just send that link. So the patient is one tap on their smartphone away from being at the place where they can enter their credit card information and kind of be done with it. But it's interesting to have watched it for so many years. Since I can remember, and since you've known me for a very long time, this is it's just been something we've always kind of struggled with. How do you get people to pay these statements when, especially with mail, they don't even see them anymore?
That's right. That's right. Yeah, at the very minimum, if they're not going to click that link, it'll prompt a phone call. And so much so that when we send those text messages out, that we now have to forewarn the office and forewarn our staff, hey, text messages are going out today, because it's going to provoke a lot of calls, which is wonderful. If somebody may have a larger balance and they don't want to necessarily click on that link, but put together a payment plan. But either way, it's impacting revenue in a positive way for the practice.
Yep. That makes sense. So switching gears a little bit, as it relates to coding and kind of the changing landscape around coding for different types of visits and new codes for using different technology, how frequently do you see maybe practices that are performing services that they aren't either billing appropriately for, that they should be billing something different or something greater for the work that they're doing, or aren't billing at all because the landscape is constantly changing? And what role does Svast play in kind of identifying those opportunities for practices?
Sure, great question. And I would say that 100% of the people that and the physicians and practices that come our way are in that, they're in that state. So by the time they call us, they realize something's missing. They just don't know what. So we recently onboarded a practice in Sarasota, Florida, neurology and dermatology practice. And the practice administrator said, I know we're missing revenue. I just don't know where. And I feel like we have a high level of adjustments and we just don't know why. So within 3 months of onboarding that practice, we improved their revenue by 32%. So, wow. And that was directly related to coding. So they were missing, we did a quick chart audit and found that there were items that were documented, not billed for, that they didn't realize they could bill for. There were many missing modifiers, and there were just standard coding errors that they were missing, especially with dermatology. It's quite involved. So that advice, that chart audit, we also did a fee analysis. They hadn't had their fees changed in some time, probably 2 to 3 years. So
leaving money on the table.
Leaving money on the table. And we look at that in 2 ways. We can do an immediate fee analysis, which is, we generally recommend about 1.5 times the Medicare reimbursement rates. But when we're posting payments, we take a second pass at that. So as we're posting payments, if we see a payment come in at the charge, we know it's time to increase for that particular particular code, because we have a payer that is likely going to pay more, but they're only ever going to reimburse for what you've submitted for. We take a look and find where the highest payer is. It's usually a commercial payer, and raise the rate accordingly. So there was several thousands of dollars on a monthly basis left on the table with the fee analysis alone. Coding was a huge secondary to that. And then certainly understanding modifiers and how they can augment the services and increase the reimbursements.
Got it. Yeah, that makes sense. It's always, it seems like the same story since the beginning of time in revenue cycle and billing services. It's just hard to stay on top of, and most practices don't have the expertise to do even a simple thing because it's not that simple unless you're an expert in it, to update your fee schedule and make sure that you're capturing kind of the maximum dollars that you can for the services you're providing.
Exactly. We also, what we see often, and especially now in 2021, we had the new updated requirements for evaluation and management coding. And so many practices were defaulting to undercoding for the fear of an audit. And so, advising that, in that way, in a meaningful way where it was going to impact revenue for them, and providing cheat sheets, if you will. If you hit the top 5 criteria, you will meet the criteria and the level for that particular code. And that was highly beneficial for that same practice that I referenced earlier.
Got it. And are you guys still doing, I think, kind of clinical note templates that are designed to make sure that you touch on, if you're billing out a 99215, that you're touching on the things that you need to bill out for that high level of code?
Yes, we just did a presentation for another dermatology practice, quite large, 45 providers in 23 locations.
Wow.
And yes, so it was a huge presentation over the last several months, but yes, we gave keywords that would allow them to code appropriately at the level, and they were widely undercoding. And again, it was for fear of an audit, but using those keywords, making sure they hit the level of complexity, making sure they were documenting the time involved, all matters. And so we gave them step-by-step for each level of the E&M code to make sure that they were not only documenting appropriately, but being paid for what the services that they performed.
Yeah, makes sense. Yeah. I wanted to touch on something you said back a few minutes ago. I know that a lot of these practices, certainly on the smaller side, are kind of like family. And so the idea, obviously, that Svast is an extension of that practice, I think is an important, and by, I guess, naturally an extension of that family to a certain extent. That's really important. I'm curious about, and this isn't something that we've talked about at all. I'm curious about COVID and the likelihood of practices losing people that are maybe the only people in the practice that know how to do the billing, and where that plays in now, because I know that there's just staffing shortages are real in healthcare, like they are in kind of everywhere else. But you kind of have to walk this fine line where it's like, we're not there to replace anyone of the family. We recognize the practice is a family. But we do recognize that staffing shortages happen, and we want to make sure we're there for you in the case that happens. So how is that still kind of the mentality in a lot of the kind of smaller physician practices, is that it's family, but sometimes in family, I guess things can go wrong. You can, something can happen, and you're going to need somebody to help you with, some billing expertise that walks out the door.
Very well said. I would say that's 100% accurate. We always want to make sure that we are in tune with each practice as an individual practice, that we understand the nuances client by client. And that's from a 1-doc practice or to that 45-doc practice that I mentioned. It's really important that we forge that relationship strongly, and we augment our services and grow with the practice. So if there's a need, we develop sort of a plan, practice by practice. We've augmented our services to include charge entry, fee analysis, chart analysis, things that are outside the standard contract, but we're happy to step in and do on behalf of the practice. We've had some practices that have a fear of an audit. Things have changed with coders in-house and staffing in-house. And we had one practice that went into a chart audit, reached out to us and said, we're struggling, we're getting audited by Medicaid and it's a heavy fine. Can you help us out? So we did a pre-audit for them and found exactly where things were going on. Made some recommendations, and they were initially going to be fined just shy of $250,000, and that was reduced down to $13,000 based on our recommendations and findings.
Oh, wow.
So offering services that can help, and this was a one doc practice in rural Vermont. So, that mattered. That would have closed the practice down. So we those are the meaningful things that we can do. Like I said, chart audits, not only just in an emergent case like that, but, just to make sure that they're capturing all of their revenue on a daily basis.
Makes sense. Okay. So I guess just to kind of circle back on practices and as practice kind of work through what they can do to maximize revenue, to make sure they're billing for everything that they can, what are like the top 3 metrics or KPIs that every practice should be looking at every single cadence? Like every month you should know off the top of your head, like X, Y, and Z. What are those 3 things?
Yeah, so, I think it varies practice by practice, but the top KPI for me is always that first pass pay rate, making sure you have a clean claim going out the door, not delaying that payment. We want to take a look at your collections, your percentage of collections against charges. And we also want to take a look at the percentage of your AR. We don't want your AR more than 1.5 times your charges or less. But it depends again on the specialty or the payer mix. So, having the, VA claims or work comp as part of we have a lot of pain management practices where work comp may be part of that equation. They can take a long time to pay. Auto claims can take a long time to pay. And again, specialty by specialty, we want to take a look at that. Balance against MGMA. We meet or beat MGMA standards each and every time. So our collection rates are, we're at 99.7% of the collection rate right now against charges. So we touch every claim, we document everything we touch. Those would be my top. But as far as, in-house taking a look at a practice and making sure that there's processes and efficiencies, that's a little bit different. And I would have practices ensure that they're handling eligibility as their priority, making sure that the patient is eligible for the insurance at the time, and not to confuse that with a prior authorization. Just because the patient's they've run the automated eligibility through their system, does not mean that the service itself is covered. And there may be a service that requires prior authorization. So having that in place, initially and before the claim goes out the door, saves a lot of headache on the back end trying to chase that money afterward.
Makes sense. So one other thought I just thought of, and I think you'll appreciate, there was always this promise of like electronic medical records being able to kind of automatically code and bill out for a service. And this was something that people started talking about 15 or more years ago, where the note would automatically would be coded and everything would just happen magically, and then the dollars would show up in the bank account, and that would be it. Has the electronic medical record software moved anywhere closer to that vision from 16 years ago, or is it still just such a complicated process that it actually needs someone to babysit it and make sure that things go smoothly?
There's a twofold answer to that, but there are some templates that can be created, and there is some it is a bit intuitive where it can make a recommendation for a level of coding. However, it doesn't read the note for you. It can't clearly understand what may or may not be captured within the physician's note. Only if the physician or somebody who is a scribe or can access that and make sure that you're not missing that revenue. So there are some automated components to it that work well, but does the EMR understand that there are new guidelines with evaluation and management coding? No, it doesn't. Does it know the time that you spent? Does it understand the complexity? So no, it can't do that without somebody really truly understanding what's happened with that patient at that time.
Right, that makes sense. And then I guess that's a part of kind of the struggle when implementing super, formatted or highly structured notes, where I remember many years ago going to doctors and saying like, all right, well, you just got to go through this list of 100 checkboxes, that are yes or no, and you have to check them off. And that's how we're going to know what this should be built out as. But I think what we learned in that process is that like that's not generally how doctors like to practice medicine. The narrative is important. The SOAP note format is still widely adopted and used. And so trying to put a physician or any other clinician in a box and saying like, all right, you're just here to check things off and go down a list, like that isn't exactly the way most people like to practice. Has that changed at all? It seems like the narrative is as important to most practicing providers as it ever was.
Yeah, I would say you're 100% right. And, having a strong practice manager in-house that understands that and can work, in concert with an outsourced billing company is really key. I think that having that second set of eyes, but having somebody in-house that knows or can be in contact with the physician to guide appropriately is really helpful too. And that's a missing piece in a lot of practices. It's a piece where we step in often as interim manager, or we can coach somebody, we can train. We're working on currently on about 15 different platforms right now. So we're intimately familiar with the back end of it and can coach accordingly with the in-house biller to work with the physician to make sure that they're documenting appropriately as well.
Got it. So long story short, you don't see a near-term future where the EMR does it all for you and it just magically happens, and the regulatory requirements and billing changes are going to get simpler. It seems like it's as complicated now as it's ever been, which is why it's really important to know your stuff.
It really is important to stay abreast of the carrier rules and regulations, to understand the requirements, to understand, the implications for the practice, financially speaking. And again, I wouldn't say that the carriers go so far to make it so complicated that you can't collect, but it sometimes can feel that way. So really, again, that's where we step in. That's where Svast plays an important role. We stay ahead of those. We educate the practice. We bring those changes to the table long before they're implemented. We review with the practice. We make sure that if something needs to happen within their system, to account for that and to allow for that, or if there's some training at the front, that we also educate.
Perfect. Well, that's amazing. It's been amazing catching up with you, Alicia. Thank you so much for taking the time. This has been a bit of a blast from the past because I don't think about billing as much these days as I once did. But it's exciting to find a world where there's, communication, which is clearly, something I think a lot about, really intersects with revenue generation and what's possible as long as you can kind of reach the patient, which is where we live. So thank you so much.
Oh gosh, thank you, Ethan. Appreciate the time.
We'll do this again sometime.
Yeah, my pleasure.